regarding the real situation we are facing, and take our suggestions on how to improve the workflow, maximize patient care and well-being, at the same time reducing health and mental risk for healthcare workers. At the moment, they're imposing bullish rules on us, restricting resources to us to work efficiently, and silencing us from within. And the one and only state ID physician here is not providing the support and help needed by other smaller hospitals in the state. These so-called higher authorities just brush off our questions, our request for help, and apply blanket rules on everything and every patient.
Okay, thank you very much. Sorry. Oops. 1 second. Okay, so our next, sorry guys. That was the text. And next is Dr. Safura Jafar. Adakah anda rasa pihak atasan faham masalah-masalah anda?
Mereka dengar, tapi akhirnya kena follow juga what the superior said. Dengar bersyarat je.
Apa boleh dilakukan oleh pihak atasan?
Kami perlu ruang yang sesuai untuk bekerja, tempat rehat yang sesuai, tempat sembahyang yang elok, tempat mandi yang elok, tandas yang elok. In my workplace, 2 toilets are shared by 200 people. Please give us optimum hours of working. Please give us enough PC to work. Nak enter data pun berebut. Data nak hantar cepat. So, pakai laptop sendiri and data internet sendiri.
Thank you very much. Next, Beverly Jorman, Sabah. Beverly?
Question.
Yes, sorry. Are you overburdened?
The amount of patients are ever increasing. The public lack in knowledge as to how severe this is, how one man can infect several others by just walking around the street. The government should emphasize on that on social media and whichever way possible. What if one day the frontliners burn out to the point where we refuse to go to work? After all, it is the contract MOs that are chosen to be the frontliners, and what the government is doing in return for us, contract. We are paying for something we didn't even ask for. We are facing the consequences of someone else on a daily basis. It's frustrating. It's exhausting.
What can the authorities do?
Take time to listen to us. Listen to our concerns instead of just merely pushing us and coming up with new ideas to suck more blood out of us every day.
Thank you very much. Next up, Dr. Kor Swee King. Adakah anda rasa terbeban?
Bagi pihak rakan-rakan saya di barisan hadapan, pihak yang membuat peraturan bukannya pihak yang terlibat dalam klinikal dan peraturan yang dibuat tidak praktikal langsung. Masalah yang dihadapi oleh orang klinikal sentiasa tidak dilayan dan tindakan diambil dengan lambat. Pihak atasan hospital kurang menanggung beban dan tanggungjawab bersama pada ketika yang kritikal.
Apa boleh dilakukan oleh pihak atasan?
Sekali lagi bagi pihak rakan-rakan saya di barisan hadapan, semua peraturan patut dibincang dengan pihak yang menjalankan kerja klinikal, bukannya pihak atasan yang tak pernah menyentuh pesakit. Sebarang masalah kena dibawa berbincang dengan cepat, bukannya ditunda selepas hari Sabtu dan Ahad.
Thank you very much. Alright, next, Dr. Adriana. What can the authorities do?
Listen to our suggestions and not just start implementing plans and basically doing it their own way only. Because at the end of the day, we are the one working and they are the ones that just give a plan or SOP, but they are not the one running on the ground. Rest is a definite must and no more every other day on call.
Thank you very much. Nick, one more. Can we contact you?
Sorry, in Malaysia though, it's written in this manner that in the end of the day, at the end of the day, everything will be revealed and don't trust our privacy. Even by this survey, you can still easily track who's writing.
Thanks very much, but that's not true. We won't reveal anything that was revealed from this survey, but thank you. Next is Marina Mahate. Thank you. Are you overburdened?
Yes, I work a 12-hour shift system, and I've been working every day since last Monday. Off days are provided, but schedule keeps changing. I have no time in a day to think for myself, let alone my own family. Trying to stay optimistic, but the mental and physical exhaustion is getting to the best of us. We have to do this in a month stretch. No information was relayed to us as to what the hours would be like, whether we will be given allowances or not. Most of us are not doing our usual on-calls during COVID rotation, hence loss of steady income as well. And I have an exam coming in the next few months.
Do you feel your superiors are addressing your concerns?
They are, but there are no favorable results, understandably. What may work for me may not work for others, and solutions often come late. We don't know who is calling the shots sometimes, which makes things harder to escalate.
What can the authorities do?
Listen to our grievances and fight for us. For starters, rotations should be kept to a shorter period, that is 2 weekly change. And there should be a better shift system, that is 3 shifts instead of 2 to reduce burnout. Also, I don't think I feel safe with the current PPE we're using. We are improvising.
Thank you very much. Next up, Dr. Sean. What can the authorities do?
Thank you once again on behalf of my colleagues in KKM to listen to us and provide support in action to cope with the situation. Deploy staffs from each department to help. Being understaffed is not the solution.
Thank you very much. Next, Adam Adli. Adakah anda rasa terbeban?
Ya, ramai rakan sekerja saya yang dikuarantin, yang tidak dikuarantin terpaksa kerja lebih waktu untuk cover yang lain. Kami kepenatan.
Apa yang boleh dilakukan oleh pihak atasan?
Listen to us.
Thank you very much. Dr. Jason Yong, are you overburdened?
On behalf of my friends at KKM, yes, we are waiting for the vaccinations to at least ease our burden and misery. Chaotic management, be it at the department, hospital, or even the ministry level, that is all reviewed retrospectively and only corrected after the mistakes have been made, is unacceptable. It's easy to give orders without even taking into account what frontliners are going through. Seriously, who thinks 600 ringgit is enough? Review again, please. We are all working with open hearts, but with the risks the government is putting us through, the money is inadequate.
What can the authorities do?
They should listen to our complaints and address them. Pushing us beyond our limits is unacceptable. Who still carries out morning rounds and CME, continuous medical education, in their departments? Guess what? Most of the departments are still doing it, and guess what? We are getting clusters from them. Seriously, we call ourselves medical personnel? Who should be blamed?
Thank you very much. Dr. Othniel, what can the authorities do?
On behalf of our frontliners, provide proper room to rest and sleep in on-call room and on-call food. What we are having now is just a couch at a common area. Sometimes we sleep at a patient's empty bed, the pantry, or surau.
Can we contact you?
Sorry, but I prefer not to, as I have a bad experience of lodging a complaint through a proper channel, but then they revealed my identity to those that I complain about. Never again.
Thank you very much. Next, Joe Kukatas. Are you overburdened?
Yes. Many have fallen sick or are undergoing quarantine. We are short-staffed and our staff have been borrowed to COVID wards and to cluster hospitals, leaving us short-handed. I work in the emergency department.
What can the authorities do?
Listen to our feedback instead of going for endless meetings with no outcomes. Know what is going on in the field rather than just looking at reports. We need equipment, we need beds, we need proper infrastructure. Our facilities are overcrowded and beds are constantly unavailable. Patients wait for days to get a bed in the wards. Meanwhile, we have patients who keep coming in and we have no place to put them. There is no more infection control in our emergency department. Beds are so closely positioned that it becomes impossible to prevent cross-infection. We do not have enough oxygen ports. Our makeshift oxygen tanks take up space. We do not have enough ventilators. We have seen other non-COVID related patients die because of a delay in treatment due to the overwhelming COVID cases. Patients are discharged too early to make way for other patients and deteriorate at home. No, it is not okay. Our hospitals have been overtly short of ICU beds even before COVID. Now, with COVID, it has become impossible. Nobody has highlighted the truth to the public.
Thank you very much. That's the last of our sharings, last of our readings. Once again, thank you very much to all of you here who helped to read out the messages on behalf of our frontliners in the field. It's quite a harrowing scene. I guess after reading all that, I just wanted to ask those of you here who helped to read whether maybe they had some thoughts or feelings or reactions that they wanted to share perhaps. I asked a few earlier to volunteer. Maybe is Marina here?
Yes. Yeah, it's quite dismal reading. You know, all these responses. I was just reading a news report today that said that the number of patients in ICU has reached an all-time high. And when you read that and you read all what the frontliners are actually saying, it's really, you know, disturbing, really. Like, can we actually manage this pandemic or not? Can we actually treat people who actually need the treatment? And at the same time, how do we make it so that our frontliners don't themselves get infected, and then the rest don't. You know, I hope someone really listens. I mean, I think it's kind of sad that we had to do an anonymous survey in order to get these types of responses, because they don't dare say it out loud, in, you know, and put their names and faces to it. So there's obviously some sort of culture of tamping down any critical voices. And we know that outside the hospitals, so inside the hospitals must be even worse. So I really hope that people take heed and will fight for our doctors and nurses and other frontliners, because what would we do without them?
Thank you very much, Marina. Appreciate it. Dr. Sean Tam actually works in a government hospital. So thanks for being so brave to share with us. Maybe just some brief thoughts.
Right. So, I mean, from my point of view, to be honest, I have been part of the frontline team for a couple of times, and I think I must be one of those who has the good fortune of being taken care of, you know, have my physical and mental health needs taken care of by the authorities, by the people. my superiors in terms of for me every step. It is very important that there are people saying that their voices are not being heard. Actually, the last line of defense in regards to the society's health. If we fall, the society falls. So it is very important for the healthcare workers' voices to be heard, and we hope our voices will be heard.
Thank you very much, Sean. Thanks for sharing. Ambika?
First of all, thank you to all our frontliners for all that you do. Honestly, I'm so very shocked and saddened by the responses, and more so because so many of them are so afraid to even disclose who they are. I mean, this shouldn't be happening in our country. And it seems like they don't have an avenue for their complaints. How is that possible? Or even if they make complaints, no one is taking heed. Now, we are saying, and I think the people have been saying on social media, that it doesn't look like the authorities have a plan. It looks like the frontliners are saying the same thing, that there is no plan. I mean, seriously, come on, Malaysia. We really can do much better, and we must do much better.
Thank you very much, Ambika. Dr. Yongken?
Hi. I think reading and listening to the responses, it resonates a lot with us in the medical community. I'm sure most of us have experienced something similar during our years of service, and it's very sad that we needed the pandemic to exacerbate this for everyone to listen. Moving forward, I think it's important for us to highlight this chronic underfunding, understaffing, regardless of who we are, whether we are KKM staff, we are NGOs, we are civil society personnel. I think we must push for better allocation to our healthcare system, push for significant change, push for better working conditions for our frontliners, and also, most important, for our safety of our patients. That's all. Thank you.
Thanks very much, Doctor. Okay, next, Joe.
Thanks, Nat, and thanks everybody, and especially the frontliners. It is quite dismal hearing all these accounts of exhaustion, being overburdened from so many people, and a representative sample of I think how many are feeling. I think I just want to say that it feels like this is something which is preventable if there's proper planning, but it feels like there's not really a proper plan, that the authorities are treating this pandemic as something that will go away very fast. But in fact, it seems like there's a lack of funding is one very large issue, and a lack of personnel. So if this pandemic is something that's going to be with us for a long time, or we should think it's going to be with us for a long time, so people can plan far ahead, start to train other people, start to train more personnel to take over some of the work in the front line, which can be done by newly skilled personnel, to free up the more skilled personnel to do the work that they need to do. But it sounds as if some of the very skilled personnel are having to do everything. So where are the people behind the frontliners? Where are the people helping them in easing their burden? I think it sounds like no one's planning long term for those strategies, and I think they need to be put in place. And from what I think Dr. Jung said earlier, this is something which has been a problem for a long time. Overcrowding, a lack of beds, a lack of skilled personnel seems to be a long-term problem, and now it's coming to a head. So we need to, as a country, plan, strategize for the long term.
Thanks very much, Joe. I read most of the responses, and almost all of them said they were understaffed, need more doctors, and so on. Thanks very much. Okay, next up, I believe, is Dr. Jason Yong.
Hi, thanks for organizing this initiative. I'd like to impress upon all the viewers, especially those who are not in the medical field. This is just a snapshot of the current grievances of the frontliners now. Actually, for those of us who are privy to our friends in KKM, this has been going on almost since the beginning of the pandemic. And this also highlights one symptom of a much larger problem, is that our Ministry of Health has been grossly underfunded for the past many years. And this pandemic just exacerbates the pre-existing problem. And by and large, I think the welfare of our healthcare staff has been severely neglected, because doctors or nurses, they are grossly underpaid, and this has been going on for as long as we can remember. And yet, I would say that we still deliver, KKM still delivers pretty good healthcare service. It's just that over the years, KKM has somehow or other not investing in its greatest asset, which is the staff, the doctors, the nurses, the healthcare personnel. So this is a big vicious cycle that needs to be broken if we are to win this pandemic. So here's to hoping that we take care of the welfare of our doctors and nurses who are still in the Ministry of Health in Malaysia.
Terima kasih Dr. Jason. Basically kalau kita dengar juga pandangan keseluruhan tadi, kebiasaannya kita mendengar tentang laporan harian yang dikemukakan oleh Ketua Pengarah Kesihatan. Gambarannya kelihatan semuanya kelihatan okey, sebab posisi dan individu yang mewakilinya itu kelihatannya tenang, dapat berbicara dengan baik dan menerangkan update terkini tentang COVID-19 di Malaysia. Namun hakikatnya mereka di bawah, siapa yang tahu, siapa yang cakna, siapa yang prihatin terhadap suara mereka. Kita akan teruskan mendengar komen dan juga respon daripada rakan-rakan kita. Saya dengan ini mempersilakan Saudara Fatin Majina Nordin, silakan.
Terima kasih kepada Fahmi dan juga Nat. Saya ingat ini satu usaha yang baik, ikhtiar yang baik untuk mengangkat suara-suara frontliner kita ke hadapan, ke tengah masyarakat. Sebab saya ingat isu ini, perkara-perkara yang dibawa sangat kritikal dan fundamental, isu staff, isu cuti dan sebagainya. Dan saya ingat sama seperti yang lain, kita telah hampir setahun dan saya ingat sebagai yang menguruskan kementerian dan sebagainya perlu ada action dan seperti juga yang disebut oleh yang lain, saya harap sangat semua yang kita baca tadi dilihat dan diambil tindakan yang sewajarnya. Kita bukan sekadar dibaca untuk pengetahuan, tapi saya ingat kita boleh bawa ini kepada pihak datang mengambil tindakan dan kita perlu bantu bersama-sama para frontliner kerana mereka lah orang pertama yang menjaga keselamatan kita pada hari ini. So saya ingat kita jaga kita diteruskan dan kita terus memperkukuhkan diri dan bersama-sama dengan kita punya frontliner. Saya ingat itu saja. Terima kasih.
Terima kasih Fatin. Untuk makluman semua juga yang mengikuti perbincangan kita masih lagi buka soalan questionnaire ni kepada mereka ataupun para doktor, medical officer ataupun mereka yang terlibat secara langsung dalam task force COVID-19 terutamanya untuk mengemukakan cadangan, pandangan dan respon mereka. Kita tidak tutup untuk hari ini. Barangkali selepas ni kita akan buka untuk frontliners yang lain, tetapi untuk hari ini kita berbicara tentang topik berkaitan dengan medical kita families. So saya teruskan dengan Adriana.
Okay, thank you so much for the organizers for this. See, every day we reach similar news like understaffed or underpaid and tired and all that. But I think reading it in this direct from the frontliners itself is still very heartbreaking to read. And I think for me even more, because I'm waiting for my housemanship, and all of us, a whole lot of us are still waiting. And for us, we are just like eager to go and help. So like, because we know it's short stuff. So can you imagine knowing that we can help, but just like waiting to be deployed? So yeah, I know maybe we can't like really help in the very, very crucial or very, very important stuff, but I know we can still work in the back line covering where the frontliners can't cover, And I think the most common complaints that we are reading today is listen to us. And I think we are really glad that we have MMI doctors, MMA, other NGOs who are really voicing out for our doctors. And so we hope listen and do something about it.
Terima kasih Adriana. Teruskan dengan Badar Arun.
Arun? Ya, okay, saya ingat actually the issue is sangat serius lah, dan saya nak ambil kesempatan respect semua frontliner kita. Dan saya melihat kadang-kadang ramai juga rakyat sekarang pasal COVID merebak luas, ramai rakyat juga sangat panik dan banyak yang menuduh our hospitals are not moving faster, mereka contact, panic dan sebagainya. But I think kita semua kena be reasonable, kerana kita juga ada dengar mental state of some frontliners, cubaan membunuh diri. I think we are coming to a macam breaking point lah. And I think suara grassroots itu penting. Saya ingat dalam masa yang kritikal ini, important untuk authorities yang orang-orang besar di KKM dan kementerian dengan pandangan frontliner. Ini sangat penting supaya mereka ni pasal dia day to day mereka buat kerja, mereka akan tahu solution. Di semua tempat pun rakyat yang buat kerja itu dia tahu solution dia. The best answer because their experience, pengalaman itu penting. So wishing all the frontliners all the work, all the best. You're doing a great job and kita harap rakyat Malaysia yang dengar program kita pun akan sabar dan membagi sokongan yang sepenuhnya lah. Kita harap dengan COVID ini kita boleh fight against racism, isu-isu perkauman, orang bukan warga dengan warga, refugees and all that. We are facing the pandemic sebagai satu keluarga yang besar. Okay, terima kasih kepada semua.
Thank you, Arul. Teruskan dengan Beth.
Hai kepribadian semua yang mendengar. Bila kita dengar tadi respon-respon dari responden kan, macam I'm happy to see that Sabah is included as one of the respondents. Sebab memang saya tahu keadaan hospital di Sabah macam mana, walaupun dia hospital yang cantik yang ni, tapi the moment you leave the suburban area, the hospital, the clinics sangat in a deplorable condition. So I can really feel the frustrations of the voices behind the questionnaires that were sent out last week. And then lagi-lagi lah, the spike of the COVID came after the Sabah PRN, and then people are looking at Sabah as though we are the one who created that spike. Jadi itu yang bikin we felt discriminated, victimized, that kind of thing during that time. And yang kami kesian, memang tidak cukup doctors, nurses, and other MOs di Sabah. Memang sangat ketara. And I know from my friends here also that they were deployed to Sabah during the after the post Sabah election. And I've got friends also yang bantu untuk bikin PPE. They made the PPE then they don't distributed. Semua voluntary, semua kawan-kawan NGO yang cuba untuk meringankan beban kekurangan PPE semua ni kan, mungkin it's not the best quality, but at least the NGO friends, even individual came forward and helped to make the PPE. Dan satu lagi kan, inilah satu caranya saya rasa kan, for the KKM staff or anybody in the civil service to work together with the CSO or the NGO so that we can find a better way out of this whole pandemic. Thank you. Itu saja.
Thank you. Salam buat orang Sabah. Saya teruskan sama ada tu Puan Safura ataupun Datuk Zainal. Okey, Datuk Zainal silakan. Datuk Zainal dulu, nanti kita pergi pada Puan.
Ya, terima kasih kerana memberi peluang kepada kita untuk berkongsi. Sebenarnya saya hampir lebih 30 tahun dalam kementerian dan saya pernah menjadi pengarah negeri, dua negeri dan juga di Putrajaya. Dan sekarang sebagai Presiden Persatuan Pakar Perubatan Kesihatan Awam, kita mempunyai ahli di seluruh negara yang frontliners dan juga yang di hospital, yang barisan belakang tadi. Betul, kita ada dua barisan yang betul-betul sangat penting. Saya terima banyak keluhan, rayuan masa di masa wabak di Sabah yang meningkat tu, hampir setiap malam saya terima mesej daripada staff. Tolonglah sampaikan, tolonglah ni. Sampai sekarang pun kita terima juga, terutama dari staf-staf di Barisan Harapan. Misalnya isu baru, bila membuka CAC. CAC maka dia akan tarik staf sana, tarik staf sini untuk man the CAC. Tapi staf tak bertambah, jadi beban bertambah. Jadi ini akan menyebabkan kelesuan, fatigue kepada staf kita. Jadi kita pun telah banyak kali membangkitkan isu ini kepada pihak atasan dan kita mahulah supaya kita re-strategize, tengok balik. Suka saya cakap bahawa sometimes bukan salah frontliners ataupun backliners, tapi salah kita yang buat polisi, strategi yang tidak precise. Itu saya selalu sebutkan. Tapi mesti kita betulkan ini dan menaikkan balik semangat kaki tangan kita yang memang bersemangat, tapi makin lama makin turun. Ya, terima kasih.
Terima kasih Datuk Zainal. Kita ada lagi 3 orang. Okay, boleh bersabar. Anda boleh like, boleh share dulu page POWR untuk manfaat semua yang mendengar suara ni. Kita akan pergi kepada Tuan Safura, silakan.
Terima kasih Fahmi. Well, I just want to add saying that I have been in the Ministry of Health for many years, just like Dr. Zainal, and I've seen how the health sector has grown, you know, over the last 30 years, 40 years. We've done well. And I think Malaysia is blessed with very dedicated healthcare personnel, healthcare staff, irrespective whether, you know, they are in the private or even in the government. But and they are so dedicated that, you know, even whenever there is crisis, when there's urgency, they always normalize themselves. You know, they will you know, like water finding its own level, and they will try to manage. But I think this one particular pandemic is something that has not come by. You know, for those last 40 years, we've always have some you know, spurious short epidemics, but this one is huge. And now, like the calls of everyone that's now, particularly from our frontliners, I think the few that have shared is representing the many. Yes, many of them shy away and work their butts off, but I think the few that can speak on the other behalf means a lot for the rest of the healthcare staff. And I think it's time, and this pandemic will continue. We do not know for how long. And I think it's also going on, meeting some imminent breaking point. You know, so it's a call that requires togetherness in the planning to help not only particularly the frontliners, and also the community at large. So this is also a call from many of us to the people who make policies. Thank you, Fahmi.
Terima kasih. Seterusnya saya pergi pada sahabat lama, tak jumpa. Saudara Adam Adli.
Right, terima kasih kepada POWR dan ABIM atas inisiatif, sebab keluarga saya ramai yang terlibat di KKM, termasuk isteri saya. Jadi isu sebegini sebenarnya adalah isu yang agak dekat juga, dan sebenarnya agak menakutkan dan juga sebenarnya agak membimbangkan apabila kita fikir bahawa pertama, selepas hampir setahun, kita bukan menjadi lebih efisien, tapi kita seolah-olah menjadi mundur dalam soal pengurusan pandemik. Yang kedua adalah selain berhadapan dengan wabak, kita juga rupanya masih lagi dirudung dengan virus ketakutan, di mana dalam usaha-usaha kita untuk keluarkan masyarakat, keluarkan negara daripada pandemik, termasuklah kebebasan ataupun kebebasan untuk frontliners kita berekspresi pun rupanya disekat, dan ini adalah sangat-sangat membimbangkan. Saya fikir memang kita harus gerakkan lebih banyak lagi masyarakat, sektor-sektor masyarakat, civil society, NGO, kumpulan-kumpulan mahasiswa dan sebagainya untuk bergerak dan bantu negara, bukan sekadar gerak kerja yang macam kita nampak sekarang, derma dan sebagainya, tapi juga dari segi terutama sekali kesedaran masyarakat untuk bersama dengan frontliners berhadapan. Dan banyaklah, dan saya tahu macam mana sekarang ni sangat-sangat understaff, ramai staff yang neglected, ramai staff yang tidak cukup rehat, dah kerja lebih daripada waktu yang sepatutnya. Dan saya rasa ini sangat membimbangkan lah, sebab kalau dia punya frontliner sakit, siapa nak jaga orang awam pula lepas ni. So saya juga ambil kesempatan untuk ucap terima kasih kepada semua frontliners, bukan hanya warga KKM tapi juga semua yang terlibat selama setahun kita berada di bawah pandemik ni.
Terima kasih Adam. Seterusnya SK.
Terima kasih Fahmi. Dulu saya pernah bekerja sebagai doktor di KKM, sebagai frontliner jugalah. Dah 10 tahun dah tak kerja doktor, so saya nak bagi salam tabik hormat kepada semua petugas barisan hadapan bangsa sekarang. Dah lebih setahun dah kamu bertungkus lumus membendung wabak COVID, memelihara kesihatan rakyat Malaysia dan juga memelihara kesihatan saya dan keluarga saya juga. Terima kasih. Kita berada sekarang di saat yang lebih kurang genting untuk negara Malaysia. Tanpa plan dan dasar-dasar kesihatan yang berunsur jangka masa panjang untuk membendung wabak ni, semua gerak-geri ataupun tindak balas ataupun polisi kerajaan memangnya berunsurkan tempoh yang singkat ataupun short termist in nature, bukannya long termist in nature, maka ini perlulah diubah sesuai oleh kerajaan dan mempertingkatkan lagi respons ataupun strategi untuk kita membendung COVID. Sebenarnya bila kita tengok keadaan semasa, bila kita tengokkan jumlah kes harian R0 dan sebagainya, kita selalu tengok dari satu sistem. Tak pernah juga kita menyelami perasaan dan keadaan hari demi hari ya untuk semua orang yang bertugas di barisan hadapan. Maksud saya kita dah lali. We're numb to the numbers that we see on a daily basis. We forget what it's like to be on the front lines. We forget what it's like to be a patient. We forget what it's like to be a frontliner. Sebab kalau kita tengok kan, semua ni cerita manusia. These are human stories. They are now tired to such an extent that sleep cannot cure. Letih dan lesu sampai tidur pun bukan ubat, bukan penawar. We have to do better for them and we will continue trying. Terima kasih ABIM, terima kasih POWR. Over.
Terima kasih SK. Hakikatnya semua frontliners adalah manusia, mereka juga punya keluarga, punya suami, punya isteri dan keluarga yang lain yang perlu dijaga. Saya fikir untuk penutup, saya berikan ruang kepada Presiden ABIM Saudara Mahmud Faisal Abdul Aziz untuk menyampaikan ucapan. Isteri beliau juga adalah merupakan seorang doktor. Silakan.
Assalamualaikum warahmatullahi wabarakatuh. First of all, ABIM and POWR, we would like to extend our gratitude to all frontliners who have shared their heartfelt feedback through this online form provided. And of course, this is the second collaborative effort between ABIM and POWR in helping the frontliners. Our pioneer project was to provide the childcare services for them. Alright, through this feedback, it is important for us in our effort to acknowledge the hardship and sacrifices endured by the frontliners. And among the issues pointed out are the shortage of staff, especially when many have to go into quarantine with relation to COVID-19 infection. And apart from that, a lot of extra hours, as what was said, of work were put in without having been given enough due compensation, either through money or leave. And our main concern is that the risk of potential burnout among the healthcare workers, which can further lead to more serious mental health disorder like depression. And as such, the higher authorities from the health ministry should consistently monitor the situation and create a fair and healthy working environment for the people who are working for us the hardest in our country at the moment. Terima kasih kepada semua frontliner yang memberi respon kepada borang feedback survey. Ini adalah merupakan satu effort ataupun usaha bersama untuk kita melihat, mendedahkan kepada publik ya, walaupun anonymous, tapi inilah yang cuba disampaikan. Mungkin tidak sampai ke pihak atasan, tapi sekurang-kurangnya semoga dengan usaha ini dapat menyampaikannya kepada pihak atasan bagaimana kesukaran mereka bekerja, cuti mereka dikorbankan, dan mereka terpaksa bekerja lebih masa apabila terdapat staf yang terpaksa kuarantin. Apalagi kalau mereka sendiri terpaksa kuarantin, akhirnya menyebabkan keluarga mereka juga terpaksa kuarantin dan sebagainya. Jadi itu saja dari saya. On behalf of ABIM and also POWR, we would like to extend our gratitude to Datin Paduka Marina Mahdi, to Puan Safura Jaafar, Dr. Zainal, Dr. Kor, Dato' Ambiga, Adam Aldi and all for your support for this initiative. Terima kasih semua frontliners. Kita harapkan suara ini dapat diangkat oleh kita semua sebagai rakyat Malaysia supaya dapat didengari oleh pihak atasan. Semoga tidak lagi ada sebarang usaha-usaha untuk memencilkan pengorbanan yang mereka curahkan ini. Sekian dari saya. Assalamualaikum warahmatullahi wabarakatuh.
Thanks very much, Faisal, President Abim. Thank you very much. Just to you mentioned all the readers. I just want to mention the rest as well. Jogu Kata, Sean Tam, Beverly, Fatin, Adriana, Dr. Jason, Arul, Dr. Zainal, Yunken, and Othnia. Thanks very much, guys. I don't have much to add. Just please, if the authorities are listening, please listen You know, everyone is complaining there's not enough staff, there's not enough help. For the love, please don't punish people. Don't try to punish people for speaking up. That's not the point. You know, if I'm taken care of, who's going to take care of us, of everyone else? It's available. So please, please do listen. On our side, we leave the feedback form open. If there are healthcare professionals who still want to give feedback, please feel free. We'll try to keep speaking out and trying to keep this issue alive for everybody. Great thanks to Fahmi, my co-host. I think we won't want to go on for too long tonight. To say thank you very much to all the readers, thank you very much to all of you at home, and thank you, of course, most of all, to all our healthcare professionals. We'll see you guys later. I'm ending this.